When conceptualizing the progression of multiple sclerosis and the accumulation of clinical disability, the relationship between visible symptoms and subclinical lesion burden can be challenging to communicate. A highly effective way to understand this dynamic is through a topographical pool model, which serves as an elegant metaphor for the central nervous system's functional reserve. By imagining the central nervous system as a sloped pool, we can visualize different anatomical regions based on their depth. The spinal cord and optic nerves occupy the shallow end of the pool, the brainstem and cerebellum sit at an intermediate depth, and the massive volume of the cerebral hemispheres comprises the deep end. In this model, focal inflammatory disease activity is represented by topographical peaks rising from the pool's base, while the waterline represents the strict clinical threshold for symptom manifestation. Because the water is translucent, we can simultaneously appreciate both above-threshold clinical signs and sub-threshold lesions. In the shallow end, representing the spinal cord and optic nerve, even a relatively small focal lesion easily breaches the shallow waterline, immediately unmasking clinical symptoms like optic neuritis or transverse myelitis due to the very limited structural and functional reserve of these pathways. Conversely, the deep end, representing the cerebral hemispheres, possesses a vast functional reserve and significant neuroanatomical redundancy. Lesions can grow substantially or accumulate in high numbers here without ever breaking the surface of the water, remaining completely silent during a standard clinical exam. However, as the disease progresses and the patient's overall functional reserve declines over time, the water level effectively drops. The combined volume of these above-threshold topographical peaks ultimately corresponds with the patient's true degree of accumulated disability. This explains the classic clinico-radiological paradox, where a patient's neuroimaging can show extensive, hidden cerebral plaque burden long before severe physical disability is unmasked at the bedside.